and I'm thrilled to have all of you join us today for dialogue, the ADA dialogue, the latest episode on looking today at eye disease and diabetes and the connection. And I have a fantastic person joining me, Dr. Emily Chu from the National Eye Institute. Emily, thanks so much for joining us today.
Well, thank you for having me, Bob. I'm delighted to be here. I'm from the National Eye Institute. I'm an ophthalmologist who's done a lot of work on diabetic eye disease, both in clinical trials and caring for patients. I'm here to share some of my experience and have a conversation with Bob about how you can help yourself with diabetic eye disease.
Yes, and so, we could start with how common this problem is, that diabetes is a leading cause of blindness, and something that the good news is there's a lot that we can do to prevent eye disease.
That's right. So diabetic eye disease is the most common cause of vision loss in the working adult population. And it's about a third of the time when people with diabetes will actually have diabetic eye disease. And if you have increasing duration of diabetes, that's going to go up, and that percentage is going to go up. And if you live long enough, you have diabetes for long enough, a number of people will actually get the eye disease. And clearly, we've come a long ways for this with this disease. So there's so much we can do, and so much that you yourself can do for it. That's really important to have that information at your fingertips. So.
Very much so. And we were talking earlier, for people with diabetes, one really key thing, or I would say there are two key things, messages. One is controlling blood sugar, and there's just so much evidence that if you control your blood sugars, you can really prevent these complications. And then the other big thing is as simple as getting a yearly eye exam is just amazingly important.
Two really key points: keeping your blood sugar in good control. We've looked at it with type 1 diabetes and type 2 diabetes. Oh my goodness, you can reduce the risk of eye disease by as much as 70%. So that's something you can do. No drug can do that, but the fact that you keep your blood sugar in good control makes a huge difference. And the interesting thing is it lasts for a long time. We don't know exactly why, but as you know, Bob, the studies show that, after you stop the clinical trial, when we, have patients who are in very tight control versus those who are on so-so control, but looking at that with really tight control, really good blood sugars all the way through, even 20 years down the road, they're still reaping the benefits of that. Their surgeries in the eyes are less, progression of the diabetic eye disease is less. So there's really nothing more compelling for you to think that you can prevent eye disease by taking good care of yourself by doing that.
Yeah, it is amazing how effective maintaining good blood sugars can be in terms of eye disease. And then that second piece is the eye exam.
Exactly. Right.
As you know, we recommend that yearly. So people are sometimes confused. I've had patients say, well, I went to get new glasses and they said my eyes are fine, but that's not necessarily what we're talking about here.
Right. Well, the eye exam we talk about is getting a drop in your eye so your pupil gets large, the color part of your eye, your blue or brown eye, that gets very large. Then we can look in and see very neat problems. Diabetic eye disease can have no symptoms, and I think that's the problem. You could have 20/20 vision and have very severe eye disease that needs treatment right away. So it's really important to have those. I think, when anything, the blood sugar and the eye exams yearly are the two important messages we want to give you. And in terms of that, you mentioned, going to someone and saying, I've had my glasses checked. Well, there's some really excellent optometrists who will actually, put the eye drops and look in and see that. So you want to make sure you have that done. There are specialists who are specialized in the retina. That's what I do, medical retina specialists who specializes in this. And most general ophthalmologists will do this as well. So be sure to have that dilated eye exam to make sure that we're not missing anything during that, that exam. And yearly exam is really recommended. And if you're type 2 diabetes, we actually recommend that at the time of your diagnosis, you should have an eye exam, because we don't know how long you've had the diabetes. Is that one of the problems, Bob, that we don't know in people with type 2 diabetes?
Yeah, about a quarter of people with type 2 diabetes don't realize they have it and haven't been
Right,
diagnosed,
right,
therefore wouldn't have an eye exam. And as you said, Emily, which is really important, is you can have absolutely no symptoms and then suddenly have a change in your vision, at which
right.
point so much of what we could have done is less effective.
So even as an eye doctor, I've actually diagnosed diabetes. So what happens is that the blood sugar gets so high that patients come in because the lens in the eye, which becomes a cataract, gets very swollen. They can't see. I've seen them before, and I say, "My gosh, you got very short sighted all of a sudden. What happened?" And I say, "I think you've got diabetes." And 9 out of 10 times they've been diagnosed with diabetes. And then the eye is the window to the soul, the window to your health, to your body. You look in, you see all sorts of things. And diabetes, you can actually see in and see these changes inside the eye on the retina, which lines the eyeball, and it's really an extension of your brain power. It's really important to keep that healthy. So that's diabetic retinopathies. Blood vessels can go kaput and get into trouble, and you can develop new blood vessels. And those are things that are really, really treatable, and there's really no reason for losing vision in this day and age because of the good treatments that we have.
Yeah, that really is striking, and then although we know that a yearly eye exam can be so effective at catching things early enough to prevent any change in vision, only about half of the people with diabetes get their yearly
Right.
eye exam, and so we really need to do a lot better, and that there's just so much opportunity there.
Yeah, absolutely, absolutely. Yeah.
Well, let's talk a little bit about the treatment. So let's say you get your eye exam, and the eye professional sees some changes. What are some of the kinds of changes they might see, and then we can talk a little bit about the treatment.
Sure. So you can lose vision in a couple of ways. So people can get blurred vision. The blurred vision can be the center part of your back of your eye. It's called the macula, and it actually gets swollen up. And so you have a swelling where your best vision comes from. So it's called diabetic macular edema. And that funny term just talks about the swelling, which we can treat. But what happens over time is that the blood vessels become compromised in the eye. It develops abnormal new blood vessels that would bleed, and they could cause little floaters or blurred vision, or you can have a very severe bleed and really block out your vision dramatically. So those are some of the symptoms to look for. You may have blurred vision, little floaters, which mean usually a hemorrhage, and that hemorrhage means that blood vessels are there. And so there are two ways of losing vision. One is the swelling. The second is the abnormal blood vessels that cause havoc and really create problems. And you want to control both of them with some treatment.
Yes.
And in
Oh, I was just going to add that those blood vessels, are problematic because they're new blood vessels that form, and they're not regular blood vessels. They are much more prone to bleeding, and that's really the challenge here.
Yeah, that was a major cause of blindness. Before we had treatment, Bob and I were talking earlier about one of our favorite people at Joslin, Dr. Lloyd Mialo, actually started the whole studies on using laser. So laser is a very strong light that converts. It's a light it goes into the eye. It's actually a destructive treatment. It destroys the area of abnormal blood flow to sort of help the rest of the retina do better. And so it's a very destructive treatment. It's a light treatment that's absorbed by the eye. And that laser is done for a number of years until more recently. It was really in the past decade that we've gone past the lasers. The lasers were helpful in especially reducing vision loss from these new vessels that were causing such havoc. Before the laser, if you got those new blood vessels, 50% of the time by 5 years, people were truly blind from that. So that laser reduced the risk of vision loss by 95%. So that was a very effective treatment that Dr. Aiel started at Joslin, which is really remarkable, really remarkable.
It's really quite the story. And before my current role, as you know, I was the chief medical officer of the Joslin Diabetes Center, and so there is this great legacy of those studies that were supported by the National Eye Institute to
Yes.
be able to realize that laser was an effective treatment. And now we've moved to this
Right.
next level of treatment. So instead of destroying some of the retina to save the rest of it, in essence, you want to talk a little bit about
Sure.
VEGF therapy?
Sure, sure. Well, this is a really wonderful story. For a while when we had patients with the swelling, we could only sort of prevent further vision loss. But now with these new treatments, we can actually improve vision. So what we found is that the underlying cause of diabetic eye disease is this factor that creates new blood vessels and cause things to leak and really make things really messy. And it's called VEGF or VEGF. And we have now drugs that actually counteract that. You've all heard of Avastin, which is used for cancer. So that's one of the drugs that we use. There's several, there's 3 of them. And the kicker is that we have to inject it into the eye. So, my patients who get it say, it sounds horrible, but once you've had it, it's not as bad as it sounds. But the remarkable aspect of it, it really does improve vision. People who have lost vision due to the swelling can actually have a better, macular edema can actually improve. Patients who used to get laser for that would never improve vision, but now we can improve vision. And patients with the new blood vessels can actually have the same treatment and we can reduce the risk of new blood vessels as well. But it does mean that you have to come back frequently and be followed because it's not a one-time treatment. Quite often it's monthly. Some people can get away with fewer injections, but we do see you monthly and it gets stretched out as things get better. We don't see you quite as frequently, but it is a remarkable treatment. And even for those with new blood vessels, we still sometimes use the laser depending on the situation. So the laser is not, we haven't hung up the keys on the laser. We still use it. So we now have a combination of these powerful drugs that really have remarkably changed how we treat patients with diabetic eye disease dramatically.
Yeah, we really have 2 great treatments now, and you mentioned the need for eye injections, which people get a little squeamish about, understandably.
Yes.
One of the things that the American Diabetes Association has been doing is really to have this focus on diabetes, this focus on eye health.
Right.
And as part of that initiative with our partners VSP and Regeneron, we've brought on ambassadors, people living with diabetes that have had eye disease and have had these injections, and they talk about it. And what they uniformly say is the fear and what you imagine of it is far worse than what it actually is when it happens.
Regeneron has made a really great drug called aflibercept that we use, and another drug called ranibizumab, and which is Lucentis is also. So we have 3 great drugs that we use, and it's really nice to have that choice and be able to give it to our patients. So.
Yes, and also to plug the National Eye Institute, a lot of that research was supported, and the network and the work all around this through the Institute.
Network was remarkable in getting this information out. I guess the other medical treatments that we really didn't touch upon are the high blood pressure and also the dyslipidemia, which, people with, cholesterol issues and people with high blood pressure, that too plays a role into diabetic eye disease. So, having your tight blood sugars are really important, but also having good blood pressure control as well as controlling your cholesterol, especially your triglycerides, really have a huge impact on your eyes as well too.
Yes, very, very true. And so we like to talk about the ABCs, A1C, blood pressure, and cholesterol or lipids. And those really, doing those right prevents most all of the disease. I mean, really, it's quite a remarkable story. Maybe one other area that I think is really exciting that's happening right now. So there are cameras that can take pictures of the retina
Yes.
and gather a lot of information.
Yes.
And And there's now some exciting work around using artificial intelligence.
Intelligence. Right, right. Well, we're very lucky because we can capture photographs remotely. So for people, for example, I'll give you an example, which I think is remarkable, is in the UK, United Kingdom, they have a very great screening program where people go to their physicians, their primary care doctor, their family doctor, and they would actually be able to get photographs screened in a center where you don't have to see an ophthalmologist, but they get photographs taken. So it's really like telemedicine for the eye. And because it's a one-payer system, so the screening, you said 50% of our people who have diabetes actually get eyes examined. There, it's like over 80%. And even in our own system here in the VA, where we have a color fundus photograph that we can take, a camera that takes photographs, that we have screening for about 85% of people. So those cameras are crucial for really helping get the photos to people where they cannot be seen, and they can diagnose that. And for the first time, the FDA actually approved of this this really interesting artificial intelligence algorithm, and it actually can diagnose and tell you what type of how severe your diabetes is. It actually can give you a diagnosis right on the spot. So it's quite remarkable. So we're really learning a lot, and I think especially with COVID, we're going to be doing more medicine, and I think there's a huge need for that, and we're really going to be very interested in seeing how that evolves over time. So diabetic eye disease have led the way with deep learning and artificial intelligence in ophthalmology. Ophthalmology is very visual. We take a lot of photographs, so a lot of diseases are following, but diabetes have really led the way. And I think we're going to see some really great fruits of that in the future, and how we can help patients be seen more, and especially in the rural area where you don't have eye specialists. Even in the Indian Health Service, we have very limited number of eye doctors to be serving them. So this can really help our whole nation.
Absolutely. So you could imagine a retinal camera all over the place in different locations that are accessible to people living with diabetes. Take the quick photograph. If it's normal, you're good for a year. And if there's a problem, well, then you can get referred to the appropriate healthcare provider. But it really is an exciting game changer.
So Bob, we have a question here. It says, I went to my eye doctor because I had blurry vision and said I had something called ocular migraine. Can you speak more on that? So ocular migraines are not necessarily part of diabetes, but it is fairly common. People get migraines, which is the blood vessels in the brain that are having some issues and cause a headache. But you could have an ocular migraine without the headache, and you see different flashes of light and colors of light that you might see. And that can actually occur without really your diabetes, and that certainly is not uncommon. It's actually not rare, rather it's fairly common in the population. So
yeah, let me bring up another thing. This sort of reminds me. So we talked about retinopathy, the disease of the retina, and that is sort of very much a part of people with diabetes and can be treated. And but that's not the only effect of diabetes on the eye.
that's true. Patients with diabetes have an increased risk of some cataract, and that needs to be checked out. And also there's an increased risk of glaucoma as well. Glaucoma is a pressure issue that can be treated with eye drops, but if you have diabetes, you have an increased risk for that, for sure. So those are really important things to consider as well too. So that's why it's important. Even if you get, your fundus photograph taken, your color photograph taken of your eye, you still need to be seen by an eye care professional just to check out the other problems that you may have. Exactly. Here's a question about, should someone get an eye exam when they're diagnosed with diabetes? And I think we've covered that, right?
Yes, for people with type 2 diabetes, very much so. For people with type 1 diabetes, the autoimmune destruction of insulin-producing cells, they usually develop diabetes much more suddenly. So usually we don't have to worry at diagnosis because it takes some time for eye disease to develop. What would you say? Is that typically within
Yes.
5 years?
So the American Academy of Ophthalmology, which sort of gives us guidelines for our profession, says that within 5 years of your diabetes diagnosis of the type 1, that patient should be seen. And I think we've really pretty much stuck to that. I mean, rarely would you see a few patients who have something before that, but it's more common to be after that period of time. So.
Right. And as we said, people with type 2 diabetes could have it for 5 years before they even know. And, you know, I had a patient a couple of months ago that was diagnosed with diabetes and already had that bleeding process that you talked about. And it was just so unfortunate because it was all preventable if they had been diagnosed and gotten their eyes checked earlier. So.
Yeah, so another question is vision loss from diabetic eye disease reversible? And the answer is, of course, yes, it can be. You know, we've talked about the injections and getting rid of the hemorrhage. And if the hemorrhage is pretty severe, there is surgery we can do. It's called a vitrectomy, where we actually go inside the eye with a very fine instrument and remove the area of the blood and restore the vision. So that can actually be done as well, too.
And if you want to comment on that, when people do have that kind of severe bleeding, what might they notice symptom-wise?
Very severe bleeding, that, well, first it might come off with just little floaters or little trail of like a hair coming through, but then becomes much more severe, and to a point where you can actually lose vision and maybe almost dark black vision. So that can be pretty scary, and that can happen. It definitely can happen. And so that happens.
There are treatments that can be done.
That's right. Treatments can be done. Even injections into the eye can sometimes resolve those issues without having to do surgery. Surgery is sort of last resort for hemorrhages that stay around for too long, may cause more damage. And if they're, you know, with the new vessels, it might actually pull on the retina and cause some traction, and in which we have to relieve it and push the retina back down, so the retina may actually be detached. So you have to make sure that's not happening as well, too. So. I guess the other question is, should I always keep my eye doctor in the loop with my diabetes management?
Yes, you know, I'll comment on a study that I was involved in. You know, when people are seeing their eye professional, they're thinking about their diabetes sometimes in a different way, and maybe in a way where they're more amenable to change and to do the kinds of, you know, lifestyle changes, and, you know, being sure they take their medication and taking care of themselves. And so communicating, you know, from the primary care doctors and endocrinologists to the eye professionals, I think, is really important. And then, Emily, on your side, what might you do differently, knowing how people are doing in terms of their diabetes when their eyes are being examined?
Well, I think it's a motivating factor for patients because, you know, a lot of the questionnaires that we've given in the National Eye Institute have really put vision as being a really important sense they want to keep. I mean, they value it as much as someone having, you know, a heart attack, or as severe as having a heart attack or having cancer. So that's something they do want to avoid, definitely. So I tell them, I empower them. I say, you are probably the master of this. If you can keep your blood sugar in good control, your daily, you know, improvement on that makes a huge difference. And of course, you need to be seen, because eye disease does not go away. In fact, people have to be seen, I think, for a lifetime, because there's always small things that come up, and you need to be seen. But obviously, much less treatment in a certain stage. But when you're in the active period, you really need to be seen very frequently. And that's something that I tell them, that we become good buddies, and we just have to make sure. I also tell the doctors, their physicians, that, you know, what's going on with their eyes, because I think it does give them an idea of what's happening. You know, quite often is correlated with things like kidney, you know, problems and other problems, so that they are being checked for all that as well. And I think I think it's the motivation, the fact that they want to keep their sight, that really, I think, keeps them going.
That is a big motivator, absolutely. And very much the communication, between providers is important. And in many cases, it might be the individual with diabetes that takes that information and brings that back and forth to their different doctors. But coordinating that, I think, is really important.
Well, I think for us, we're still, and we talked about the telemedicine, how important that might be. And there's a lot of research ongoing. The DRCR net, the Diabetic Retinopathy Clinical Network, is a wonderful network that's really doing a lot of research. We're looking at, these injections that I've talked about monthly. We're trying to find ways of giving it less frequently, longer lasting drugs. There's even little ports you can actually insert in that would stay there for a long time. In 6 months, you might last as long as that instead of coming in frequently. So there's a lot of really exciting research that's ongoing. There are other drugs that might be important. Some of these eye disease don't respond to all the treatments, so we have to be always looking for something more and better. So I think the research is incredible because we really are trying to push the limit and trying to find better things at all times for our patients.
Yes, it's research. It's getting the ABCs right: A1C,
Yes.
blood pressure, cholesterol, and it's one of those things we can't say enough. Getting a yearly dilated eye.
I That's probably the big key, the real key
It
to
is,
all this.
right? Like if everybody did that, the rate of blindness would be dramatically less.
No, absolutely. Just the fact that people get screened more frequently means that they're getting to their eye doctor more, and that in itself has decreased the risk of vision loss. So it is really remarkable what we can do with that. There's another question here. It says, are some people more at risk than others for getting diabetic eye disease? So we don't know enough about genetics, really, Bob. I know that we've looked into that. It's very complicated. But clearly there are people who have really good A1C levels and do the best they can, but yet still get into trouble. You probably see those patients as well, too, Bob.
Yeah, you see people at the extremes, people that have had good blood sugar control but still develop eye disease, and then those that have had, not good control and actually don't get eye disease. So, but that being said, that doesn't negate the importance of those things. It just
Yeah.
tells us that there's more to the causes than we fully understand.
Well, I think we have to close up soon. So I think I just want to reiterate the importance that Bob talked about, the ABCs, the A1C, your blood pressure and your cholesterol, and getting that eye exam is really, really important. That dilated eye exam, make sure it's dilated eye exam that you're seeing. So.
And I'll add that a great source of information is our American Diabetes Association website that's focused specifically on this problem, and that's eyehealth.diabetes.org. And so please go there. You can read about the latest things going on, and really, we should be able to do so much better. People shouldn't be losing their vision because of diabetes.
The National Eye Institute also has a wonderful website that you can also look to and understand what the eye disease is about and how you can go about keeping your vision healthy and keeping your sight for a long time. It was wonderful to talk to you, Bob. Thank you so much for having me. I really appreciate this.
Thank you, and I really enjoyed this as well. And thank you, everyone that's been out there. Hopefully you've learned a lot, and you can learn more from our respective websites that are in the chat box. So until next time.
Bye now. Thank you.
Bye.